causes shoulder and hand pain for volleyball setters? Imagine being the quarterback of your volleyball team, constantly moving your arms in quick, precise motions. Now, picture that over time, those same movements start to hurt. That's what many volleyball setters experience. Their role requires them to perform repeated overhead sets and quick hand contacts, which can put a lot of stress on their shoulders and hands. Shoulder pain often comes from overuse injuries. When setters repeatedly lift and toss the ball overhead, their rotator cuff muscles and tendons get strained. This can lead to tendinitis or even small tears in the rotator cuff. These injuries happen because the rotator cuff stabilizes the shoulder, and constant overhead motion wears it down. If a setter doesn't use proper technique, the risk increases. Poor form can cause the shoulder tendons to get pinched or irritated, leading to impingement. Another cause is labral tears. The labrum is a ring of cartilage that helps keep the shoulder socket stable. Repetitive overhead setting or sudden awkward falls can tear this cartilage. When that happens, a setter might feel deep shoulder pain and instability, which can affect their ability to perform. Biceps tendinitis is also common. The biceps tendon connects the biceps muscle to the shoulder, and overuse can inflame it. This causes pain at the front of the shoulder and weakness in the arm, especially after long matches or intense training sessions. Muscle imbalances and fatigue play a role too. If a setter's shoulder muscles are weak or imbalanced, they're more prone to injury. Fatigue from playing many matches can make muscles less supportive, increasing pain risk. Inadequate warm-up and stretching also contribute. Without proper preparation, muscles stay tight and more vulnerable to injury during play. Hand pain in setters mainly comes from repetitive impact. When setting the ball, players contact it with their fingers and wrists repeatedly and forcefully. This can cause inflammation or tendinitis in the fingers and wrists over time. Quick, forceful ball handling can also lead to sprains or ligament injuries, causing pain and reducing dexterity. Sometimes nerve compression occurs from repetitive hand and wrist motions. This can cause numbness, tingling, or pain in the hand. To prevent these issues, setters should focus on proper technique during overhead sets. Strengthening shoulder and hand muscles helps keep joints stable. Warming up and stretching thoroughly before playing is essential. Rest periods are important too, to avoid overuse injuries. Using supportive taping or gear for fingers and wrists can help during intense play. If pain persists, seeing a professional early on can prevent more serious injuries. In short, the main causes of shoulder and hand pain for volleyball setters are the repetitive overhead and hand movements that are part of their role. Poor technique, muscle fatigue, and lack of proper recovery all add to the risk. Taking steps to improve technique, strengthen muscles, and rest when needed can help keep setters healthy and ready to perform at their best.